Hey everybody, welcome to HashItOut, and today we're going to be doing an interview with Doc Rivers on PTSD and how it affects the mind and how it changes it and all that. So, here we go. Let's introduce the man.
Hey Drew, good to see you today. How's it
Good
going?
to see you. Thank you for joining me in this video.
I'm very welcome to be here.
So, one of my first questions is, what is PTSD?
Well, PTSD is a medical diagnosis. It's post-traumatic stress disorder. And this is really an event that causes a trauma to make a negative condition to exist as a trigger to similar future events.
I see. So, does PTSD create a lot of stress?
Well, past trauma creates stress. So if you've had an event in your life that created some type of stress, you got in a car accident, for instance, and that car accident, you got hit from behind. Well, anytime somebody pulls up behind you, your body is naturally going to create some kind of stress that is a result of that incident. Is that PTSD? In a way it is, but your body is going to deal with the minor incidences of PTSD. The events of stress cause a reaction, and that reaction may be shocking, scary, dangerous. As our fear reactions turn on, those existing triggers also are turned on. So you get in that accident, 2 weeks later you're back in your car after it's gotten repaired and you're driving down the road and a blue car pulls up behind you and it was a blue car that hit you in the first place. Then what you do is, you kind of tense up. Well, that creates stress.
Yeah.
And so, your body reacts to that. So you do get a reaction, but it's not that isn't necessarily PTSD. So what happens with this stress is these are split-second changes brought on by adrenaline. And these reactions are our body's natural defense to danger or to avoid danger. So yeah, you're in your car, this other car pulls up behind you, your body may tell you, that may be danger, but in reality it's not. And you know that, and so the person stops and you get over it, and then you continue on your way. PTSD is the continuing to have physical or mental reactions based on the event or the trauma. Okay, so if you were sitting in your living room chair at home and you saw a car on TV pull up to an intersection and a car pull up behind it, and then you got, anxiety or stress,
Yeah.
that would be PTSD.
I see. Yeah, because when my mom, she got in a car accident and she rolled her truck 3 times, and through that next week she was all tense driving and all that, so she dealt with that for a week and then it went away.
It went away.
Yeah.
So the reaction to the re-experience is what is diagnosed as PTSD. And we'll talk about that here in a little bit, but that feeling of being in danger is also known as fight or flight syndrome. And when you have PTSD, you'll have fight or flight syndrome even when there isn't any.
Yeah.
Okay. So, I have had patients that have come to me that are Vietnam veterans, and they had incidences where they were driving in the forest, and that created a trigger that brought on their PTSD. But with a little bit of therapy and a little bit of working it through, we were able to overcome it, and their PTSD isn't bothering them as much.
So those are some of the reactions that are caused by PTSD.
Right. Some reactions are pretty typical when harm is perceived. So, again, we'll go back to that analogy of the car, and sometimes when you're in traffic, there is perceived danger because you see people pulling up, and it's like, is this guy going to stop?
Yeah.
If, like your mom, when she rolled her truck, within a week she began to recover naturally.
Yeah.
And within 6 months, she was probably driving regularly.
Oh yeah.
That's not PTSD. PTSD occurs when the natural system doesn't recover.
Okay.
Okay. So hypothetically, you are traumatized by some event, and every time you're presented with that event over and over again, then you get that fight or flight reaction.
Yeah.
And you continue to experience the original problem that created the event in the first place. It's like watching a video. So, not that we watch videos much anymore, we watch a lot of CDs.
Yeah.
But if you went back old school and you took a video of, say, a very scary movie,
Mm-hmm.
and you were watching it, and you got to that point where the movie got really scary and you didn't want to watch it anymore, you turned it off. And then a couple of weeks later you came back and you said, well, I want to watch that movie because I never got to finish it.
Yeah.
And so what you do is you take it and you put it in the VCR, and the TV turns on, and what is happening? That same scary scene. So that's how the video of PTSD plays in your brain, and it keeps going back to that scary scene over and over and over, and it's like a loop, and it doesn't stop. And for somebody who's had a very traumatic incident,
Mm-hmm.
It's very difficult then to function normally because that keeps getting played over and over and over again.
Yeah.
It's very harmful to a person's well-being.
Yeah. And that is something also that I have dealt with personally, is dealing with a traumatic event over and over, and even having nightmares about it, over and over. So that is something that I also deal with. I know a lot of people probably have a question about this, but can you recover from PTSD?
Well, PTSD shows itself in two categories. You have acute PTSD or you have chronic PTSD.
Yeah.
Okay. So we'll talk about the first one. Chronic PTSD is ongoing. So the incidences that you went through in your life
Mm-hmm.
that created your PTSD would classify you as being a chronic PTSD patient.
Yeah.
Okay. You're recovering from it. You're getting better because you're not letting a lot of those incidences dictate what happens to you when you're presented with, something that may be similar to your incident.
Yeah.
But you still have, to go through your treatment so that you overcome it.
Yeah.
Okay. In time, you will end up having no symptoms at all, which will be great.
Yeah.
Okay. The other is acute. And acute is kind of what happened with your mom. She had a rollover accident. 6 months later, she was over it. It was gone. Maybe she had a little bit of thinking about it, but it didn't present itself daily over and over and over again. So acute recovery is natural and statistically or medically takes less than 6 months.
Okay.
So it's just a minor PTSD syndrome.
Yeah.
Chronic, however, is recoverable, but it's an ongoing recovery, and sometimes it will be an ongoing recovery for a lifetime.
Yeah. Yeah, and that's also something that I am dealing with, but am on my way to fixing myself. You gotta have the will to get better. That's key. So what kind of treatments work for PTSD?
There are lots of different therapies that are used for, well, not a lot, but there are several different therapies that are used for the treatment of PTSD. There are pharmaceutical therapies, there are medications that are issued by the pharmaceutical industries through doctors that are used to treat the symptoms of PTSD. They don't necessarily treat the PTSD,
Yeah.
but they do treat some of the symptoms that come along with that. Anxiety, sleeplessness, and some of those things.
Yeah.
There's psychotherapy or talk therapy, which is kind of where I like to work with.
Mhm.
But the problem with some of these therapies are many of the professionals that are out there don't understand how PTSD affects a person because they've never experienced PTSD
Yeah.
at a chronic level. And that's really what we're talking about. We're talking about chronic PTSD.
Yeah.
So, if a therapist hasn't experienced chronic PTSD, say they're dealing with vets coming back from Afghanistan, but they've never served, so they've never been able to expose themselves to that, then it makes it difficult to understand what the patient really is trying to convey when they're discussing that with their medical provider.
I see.
PTSD's trauma affects the physical and mental being of sufferers of PTSD. Not only is PTSD a mental issue, but because PTSD affects people in a physiological way, there's sleeplessness,
Mm-hmm.
there's muscle pain, there's diet issues.
Yeah.
Once you get over those things, then it's easier to deal with the nuts and bolts of the real PTSD or the real trauma that created the PTSD.
Yeah. Yeah, I definitely have felt those effects to where the PTSD has obviously affected me mentally and definitely physically. When I get really, really stressed out and I'm really dealing with my PTSD, my chest will get very tight.
Right,
yeah.
so those physical symptoms do present themselves.
Yeah.
And a lot of times what happens in allopathic medicine is the care provider, the doctor or the nurse, doesn't treat the symptoms of the physical.
Yeah.
So they may prescribe a medication that treats the mental aspect
Mm-hmm.
of the chronic PTSD, but that medication may end up creating other problems in the physical realm.
I see.
Which, now you're dealing with two problems
Yeah.
instead of one problem.
Exactly.
So, there's other treatments that are available.
Yeah.
And we'll talk about that now if you want to talk about that.
Yeah. Let's go into that.
Okay. So, there's cannabis.
And that's something that my viewers know that I use for my PTSD. Really helps my anxiety, really helps depression, all of that stuff. So,
Well, cannabis is shown, I have my computer open, you can't see this, but there's pages that are open here that show that cannabis has shown promise with people suffering from PTSD, not only in the United States, but in other areas of the world where people are exposed to either the traumas of war or, whatever it is that created the PTSD. And here's some of the diagnosis that that cannabis is very good with in terms of PTSD.
yeah.
PTSD is a result of anxiety.
Mm-hmm.
We've kind of talked about that a little earlier.
Yeah.
Anxiety is a result of overstim. So let me kind of give the brainy part of it here. Anxiety is a result of overstimulation of two glands in the brain. I have a picture here, and I'll put it up so you can see it. those glands were in that picture. They're called the amygdala and the hippocampus. And these two glands control emotion and memory of the human limbic system. So when you're going through PTSD or you have a PTSD incident, those two glands really do take control over what's going on with your body. They promote either the fight or flight syndrome.
Sorry to
Go ahead. No,
interrupt,
yeah.
but that's kind of like before I got diagnosed with PTSD, my mom actually suggested that I had a problem with my adrenaline. Like, she thought something was off balance. Maybe your adrenaline is firing off
Too quickly.
Yeah, too quickly, and at the wrong time.
Right, and so what happens with so how anxiety forms is the hypothalamus communicates with the amygdala amongst other organs in your body and amongst other glands in your brain, but those two are they're the nuts and bolts of trauma.
Yeah.
The memory of old trauma and the emotion of new trauma. And so the amygdala, when it starts firing, immediately sends hormones down to your adrenal glands.
Mm-hmm.
And so what happens is when you have anxiety, your adrenal glands kick on.
Okay.
Well, if you have PTSD and you're not treating it, and that PTSD is constantly kicking,
Yeah.
or it's in that loop, like that videotape,
Yeah.
where it's constantly playing in the background, then your body never has a chance to come down off of the adrenaline.
Yeah.
Your adrenaline is kicked up all the time.
Yeah.
Okay, so your anxiety, instead of being at this level, is over here at this level.
Exactly.
And then when you really have an incident, then it just goes right through the roof.
Yeah.
So what cannabis does is it works at helping the hippocampus control the information that it feeds to the amygdala, so that the amygdala doesn't turn on the adrenal glands for that fight or flight syndrome, which then doesn't create the anxiety
Yeah.
that comes with PTSD. So this videotape that gets played plays into the hippocampus, and then the amygdala sees this and it overrides the response. And so you do end up having the same anxiety for new types of trauma.
Yeah.
Okay, so you, hypothetically, if you had a car accident and then you saw on television, two cars pulling up to an intersection, you could, because of your PTSD, have a reaction to what you saw on television, creating that that huge jump in your adrenaline.
Yeah.
And your mom was right.
Okay.
But it was like, okay, how do we fix this?
Yeah. That was the point in my life to where I didn't know I had PTSD, and yeah, that's
But you got diagnosed.
Yeah, I got diagnosed, and it was good to know what I was up against, because when I didn't, it was
A lot of demons.
Yeah.
Yeah.
So, I wanted to ask this also, and for the viewers also, how does cannabis help other people with different ailments besides PTSD?
Let's get back to the way cannabis, how it helps PTSD, and then we'll talk about that for a second.
Okay.
So with PTSD, how cannabis works to control the anxiety of PTSD is cannabis has cannabinoids. They are present in THC and the CBDs, the multiple CBDs that are available.
Yeah.
But really it's the THC. in cannabis that works. This allows the hippocampus to load other memory reactions. So when you ingest THC, whether you smoke it or edibles or tinctures or whatever method you choose to use, that medicine, when it gets into your system, allows your brain to slow down a little bit. And in the process of slowing down, then the hippocampus can decide whether or not this incident that you're faced with, this trauma that you're faced with, is truly fright, it's truly fearful, or it's no, this really isn't. Okay. And so with that, the traumatic event that's presenting itself then can pass without your amygdala turning on, like a big old spotlight, and causing your adrenal glands to kick in, which then creates the anxiety, which then creates more symptoms of PTSD, and you can override that emotional roller coaster that is caused by that. But really, there's a lot of other people that can benefit from cannabis, because cannabis will work in the endocannabinoid system. So your body builds a reserve. When you're under some duress, you get sick, you have a traumatic event, and your diet is suffering, or you have some other ailment, your body uses your endocannabinoid system, which was only discovered about 20 years ago, to repair itself.
Okay.
So this is the repair system of your body.
I see.
So if your repair system of your body doesn't have the equipment to go out and make the repairs, then your body doesn't heal 100% properly. Okay. But cannabis, and there's other fruits and vegetables that provide endocannabinoids, but not nearly at the level that cannabis does. When your body takes in cannabis, THC, CBD, CBGCH, and all those CBs, you build this reserve. So if you have PTSD and you're presented with an incident that could be perceived as traumatic, then what happens is your body feeds the endocannabinoid reserve into your hippocampus and your amygdala, and you overcome the trauma. So you don't have to be taking in cannabis all the time. You have a reserve. And so with initial patients that use cannabis to overcome trauma-based PTSD, they get anxiety, or they get, and I don't know if you experienced when you first started smoking marijuana, did you get that paranoia or anxiety?
Oh yeah.
Okay. So that's a natural reaction. That reaction is caused by your body building into the endocannabinoid system a reserve, and then now all of a sudden your body has the ability to use it, and it just hasn't learned how to adjust it.
Exactly.
Okay.
And that's why I always tell you beginners out there to always go in moderation, because there's been countless times to where my tolerance has been at 0, and I go and medicate, and it's very overwhelming. So moderation. That's very true.
But you had asked me about the therapeutic value of cannabis for other people that suffer from other ailments besides PTSD. And epilepsy has been shown to be almost curable by using cannabis. There's people in Colorado that are using cannabis to help their kids, because Colorado has approved it for the use in children. I think the medicine is called Charlotte's Web.
I've heard of that.
For epilepsy for kids.
Yeah.
Very low THC, high CBD, but for kids they don't need the high THC.
Yeah.
So neuropathy or pain, nausea, and nausea, it's people have known that for years, hundreds of years, that cannabis, when it's used, eliminates nausea.
Yeah.
Sleep disorders, anxiety, which we've just been talking about,
Yeah.
PTSD, asthma, anorexia, appetite, if you have a low appetite, maybe from cancer treatment,
Yeah.
then cannabis, if it's smoked, which is very critical on how it's dosed,
Yeah.
is very, very helpful for people who have appetite issues.
Okay. Yeah, and one of my uncles, actually, he had testicular cancer, and he used cannabis, and it really helped his appetite come back, because he had no appetite at all.
After the treatments?
Yeah, because he went through chemo, and the cannabis really helped his appetite.
Cannabis has been used for hundreds of years in homeopathic medicine, and it works very well. It's just that allopathic medicine just didn't have the research available to it to be able to use cannabis as a moderation.
Yeah.
So here you can take OxyContin, and we know cannabis works, but we don't have any proof that it works. Well,
Yeah.
that's changing because it's being studied now.
It definitely has been changing, because I've dealt with doctors in the past that I've talked about cannabis with them, and they've been totally against it, but they have no problem with prescribing me countless amount of pharmaceuticals. So
It's kind of sad.
yeah.
Well, good.
Thank you for joining me in this segment.
Yes.
There'll
Hopefully I'll
be-
join you again.
Yeah, there'll definitely be more. This guy is full of information. He is actually my personal therapist. He's been helping me out a lot. Like I said, you really have to have the will to want to get better, along with the right therapist too. Because I have had my share of many different therapists, and I never clicked with one. And I've been seeing Doc Rivers here for over 6 months.
A little bit.
Yeah, and it's been going very great, very great. So, I'll end that here. So, I hope you guys liked this video. Definitely hit that like button if you did, and subscribe for more content, because there's going to be a lot more content like this, and just a lot more other content. So, have a good one, guys. Stay medicated.